made a decision within my first few years of living with HIV that I would become very public about my status. There weren't images of young people sharing their story and using their face and their voice as a tool for advocacy. My name is Dr. Tyler TerMeer. I am a Black gay man who has been living with HIV for 18 years and proudly serve every day as the CEO of San Francisco AIDS Foundation. As a traditional HIV service organization, we started in the earliest days of the HIV epidemic in the United States. Today, more than 40 years later, the foundation exists not only as a system of support for those who need us living with or affected by HIV, but is grounded in a philosophy of health justice for all. At my heart, I have always been a theater kid. So long before I was a nonprofit CEO, I went off to undergraduate at a small liberal arts school in Ohio, and all of a sudden, people around me were out about their sexuality. And for the first time in my life, I felt comfortable owning pieces of my identity. I came out as gay when I was 19 and was every day using my jazz hands in my theater department and had just an amazing group of other gay men and lesbian folks around me. We were a small community within Ohio that finally had a safe place to be who we had always been and to have others around us to support us in that journey. As I was headed into my senior year of undergraduate school, I one day went with a group of friends to the local HIV service organization to support them in getting their first HIV tests. I had been dating someone. I thought that I was very low risk for HIV, and I honestly didn't even think about getting a test that day until it felt like a supportive moment to my friends to get a test of my own. I remember laughing with the HIV test counselor about a fun vacation I had coming up and not thinking that my life would change forever in that moment. But I also remember them leaving the room to go check my test results. I remember the words HIV positive falling from their lips and feeling like my entire world was crumbling in that moment. And I left that organization a changed person. But it was that same organization that helped me pick up the pieces of my life, taught me about my disease, taught me that I was going to live a long and thriving life with my disease, and helped me figure out what my new career path might be down the road. After my HIV diagnosis, I had to really think about who I was going to tell and how I was going to disclose my HIV status. And the more I did that, the more I realized that people my age at that time were not out about their status. And so I made a decision within my first few years of living with HIV that I would become very public about my status. I did that through joining a group of young activists around the country in a national campaign, Does HIV Look Like Me? And my face was on the cover of a local newspaper in the town I grew up in with that tagline, Does HIV Look Like Me? And from that moment forward, it became a part of my personal and public persona. Advocacy work was certainly not my first career path. I started off as a theater major, thinking I was going to go off and be the next Broadway star. But it was my internship in my undergraduate years of college, shortly after my HIV diagnosis, that really changed who I was as a professional. I was placed, ironically, at Broadway Cares, Equity Fights AIDS in New York, from an arts perspective, but it introduced me to a way of advocating for work that was happening on the ground across the country. People living with HIV cannot do this fight alone. We still have a lot of work to do to ensure that all people living with HIV or at risk for HIV in our country have the things that they need and deserve to live long and healthy lives with their disease. And that means that we need allies and community members to be lifting up our moments of advocacy, to be educated about HIV in our country, and to stand by our side as we continue to advocate for health justice for all people, but especially those who are living with HIV and struggling to get access to the resources that they may need across this country. I think my advice to someone who may be watching who is living with HIV and struggling in this moment is that there is hope.